Joining us now, who's getting all mic'd up now, is Dr. Sahayini Kumar. And Dr. Kumar is with GBMC Health Partners. She specializes in internal medicine. And thank you so much for being with us, Dr. Kumar.
Thank you, Maribeth. Thank you for having me. It's a pleasure.
Okay, so we are officially in the flu season, right?
We are, yeah. So it starts in the fall and goes through the winter months. So yes, we are officially in the flu season now.
So when you tell people to get a flu shot, you mean let's get it now, right?
Right. So October is the best month to get it, and I've had my flu shot, and if you're getting the flu shot, I would encourage all of us to get it now. If you miss it, it's okay. It's still okay to get it throughout the flu season, but I would encourage all of you to get the flu shot in October, which is the best month to get it.
We've obviously been so focused on the coronavirus, but the flu can have some significant health issues for many people, and people do actually die from the flu.
That's true. So that's one of the main reasons we encourage everyone to get the flu shot, because I would like to show you some numbers here, if we can pull up the data from last year. So this is released by CDC, and this is the flu season from last year. And you can see there were 38 million people who got the flu last season, and about 400,000 were hospitalized, and 22,000 died from the flu. And this could have been worse, but as you see here, about half the population got the flu shot last year. And this is thought to have prevented about 7.5 million flu cases and about 105,000 hospitalizations and 6,300 deaths. So yes, getting the flu shot is the best way to prevent you from getting the flu and also being hospitalized and dying. So that's one of the main reasons to get the flu. And there are many others which I can go into also. And one of the reasons you said was it prevents people from getting more sick, especially if you have chronic conditions like heart disease, or if you have asthma, COPD, diabetes. Those can all make you get worse. The flu can make those conditions even worse. So here you see that chronic conditions like asthma can get worse. And if you look at the next slide, a recent study was done which showed that the risk of heart attack was 6 times higher within the first week of getting the flu infection. So the flu vaccine helps you get the flu and also get complications like getting the heart attack or getting worse diabetes, COPD, or asthma. Yeah, so
now
that's
I know you're not a cardiologist, Dr. Kumar, but why would the flu affect your heart? Is it because of the oxygen level or something?
So flu causes stress to the body, the fact that you're infected, and heart disease can be more common when you're stressed and your body goes through this infection and stress reactions. So that could be a reason why it's more high when you get the flu. The heart attack rates go up. And for cases like diabetes, those who have diabetes, COPD, the immune response might not be working as well as when compared to a healthy patient. So the flu can make you more sick from these conditions.
Dr. Kumar, especially during this period of time when we're in a pandemic, do you feel that everyone should get a flu shot, whether they're high risk or not?
Yes, definitely. And and you bring up a good point about the pandemic, because we are in the COVID-19 pandemic, and we are expecting the cases to go up in the winter season. So you really don't want to overwhelm the health system or the hospital with more. It will already be overwhelmed because of the cases of COVID. So you don't want to keep the flu at minimum, so we can help patients who get COVID, because we still don't have a good vaccine for that. So I would definitely encourage everyone to get the flu shot today this season, especially because of the pandemic.
So Dr. Fascaldo mentioned in the conversation, and I wanted to go more in depth with you about the various types of flu vaccines. And you don't necessarily have to get an injection. You can do a nasal vaccine. Can you explain actually what goes into that and why the difference and who should get one or the other?
Sure. So the flu vaccines, the most commonly used flu vaccine for adult population is called the quadrivalent. Quad means 4, so it has protection against 4 different viruses: 2 influenza A viruses and 2 influenza B virus. And most common type of there are 3 common types of these quadrivalent vaccines, and all 3 that we usually do in adult population is the injectables. So there's the standard dose vaccine, which we all get. And then there's the high dose vaccine, which has about 4 times more the strength or the antigen, which is that's used in the vaccine to produce the antibodies to give you protection. So that's more stronger. That's called the high dose flu vaccine. And that's mostly given for people 65 and over. It's licensed to give to 65 and above. And then there's another vaccine called the recombinant flu vaccine. So, and that's a different technology that produces the flu vaccine. So these are the most common adult vaccinations we use, and all these 3 vaccinations use killed or inactivated vaccines, viruses. So they are killed, so they're not alive, and they cannot infect you. So you talked about the nasal spray, and that's it's not as common in adults, but it can be used from 2 years of age to 50 years of age, most commonly in children, as you said, because they don't need to get like an injection, and it's a nasal spray, so it's less intimidating. But it's called a live attenuated, which means the virus is weakened. So it doesn't cause infection, it's just weakened, so it kind of simulates the virus, the flu virus, and the body responds and produces antibodies that can protect you. So that's the difference.
Do people have a reaction to getting the partial live virus or the different virus strain in the nose?
No, so they can have like local, maybe like runny nose. As the usual flu vaccines can, they can get like mild flu symptoms maybe in a day or so. But it doesn't cause the flu unless, so it's recommended for 2 to 50 years, but you would be cautious if you had some, for pregnancy, for instance, or if you had immunocompromising conditions like HIV, or you're getting chemo from cancer, because it suppresses, your immune system doesn't respond as a normal person's would. So you can, there is a chance that those weakened, even though they are weakened, they can still cause the disease because your immune system is not robust enough to kill the virus. So that's the difference between the live attenuated, which you would prevent to give in certain population.
You know, we used to always hear that if you were a little bit sick, maybe you had a cold or something, you shouldn't get the flu shot at that time. Is that true?
Not for so currently, if you have say you have a significant fever of more than 100, and now with the pandemic, you always worry, oh, is it COVID, is it flu? So if there's a suspicion or if it's any question on what this could be, it's better to avoid, because we just want to make sure it's not a side effect of the flu. Say you get the flu shot today and you have the fever and you have fever for 2 more days, and now we don't know if you have the flu, if you have COVID, or if it's just a side effect from the flu vaccine. So in that case, you would avoid, but just runny nose or mild sore throat, it's not a contraindication. You can still get it.
So do you believe that all the vaccines are equal? So for example, is it always best to get it from your doctor, or can you get it from the supermarket, pharmacy?
So all the vaccines are the same. There's no, what you get from the doctor is what you get from the pharmacy or the supermarket. So it's all flu vaccines are standardized, approved by the CDC. So it's whatever works best for you. Now, we do give vaccines in our primary care office. And you bring up a good point where to get it. And we are happy to say, because there is a scare nowadays, oh, if I go to the doctor's office or if I go to the supermarket or pharmacy, I might get the COVID because I don't want to be exposed to anyone. And we are happy to say at GBMC, we have a drive-through center for flu. So you can just call your primary care physician's office or go to the MyChart app that you have on the phone, and you can pick a time you want to get the vaccine, drive up there, and you don't even have to get out of the car, and you can get the vaccine. So we have that facility, and I'm happy that GBMC is doing it.
That's good to know, because there are a lot of people who are really torn about leaving their houses at all, particularly elderly.
That's right. Yeah, that's one of the early on, even before the flu season started, I got emails from my patients saying, I don't want to come to your office. Is there any other way? And I was extremely happy when I found out that GBMC does have a drive-through center for the flu vaccine.
I think I know the answer to this, but someone has asked it, so I'm going to ask you, because many people may be wondering, can I get seasonal flu even though I got a flu vaccine last year?
Yeah, you can. So flu vaccine, the immunity doesn't last. So two reasons. One is the immunity declines over time, right? So if you got the flu vaccine last year, the immunity is not yet there, or still present for this season. But the main reason for the fact that you should get the flu vaccine is because the virus keeps constantly changes. It's not the same viruses that caused the flu last season as that causes the flu this season. So there's a lot of research that goes to constantly update the vaccines for each season. So what they predict as the common flu viruses for this season is not the same as last season. So yes, you should get a vaccine every season.
So I don't know if you can put this in layperson's terms, but how do they predict what the flu is going to be this season? I mean, we always hear we're getting the shot. Maybe it'll work, maybe it won't. We don't know if they got the strain right. How do they do that?
There's a lot of research that goes into, like, they look at the flu viruses from previous season and at the end of the season what the circulating viruses are, and I think that goes into predicting how the next season virus is going to be. I'm not the expert in how they come up with these details, but I think they use the viruses at the end of the season to predict this is what it's going to be, and we don't always get it, so it's not 100%, right? So what they predict usually is they say it's about 40 to 60% accurate. That's called the match. So you predict this is how the flu season is going to be this time, but the viruses are not exactly matched. It might be about 60% matched. That's how the predictions and the research.
And Dr. Kumar, you have to remember years when you thought they way missed the mark, right? Like you had so many flu cases, you thought, wow, we just did not hit the right strain this year. When do you know if it's been effective or not for the majority of the population?
So
by December?
So if it's less, even if it's like, say, 50% protective, it's still effective. If you look at the slide I showed you from last season, it was about 40 to 60% effective, but you still prevented about 6,300 deaths. So it's not like you need 100% match to get the flu. I would recommend everyone get the flu shot, even if it might be 50% effective, because you still protect. So one of the other reasons is even if you get the flu, it won't be as severe. So the duration and the severity will be less, as opposed to not getting the flu shot if you got the flu shot. So that's another reason. So you don't have to necessarily have the 100% match to say, oh, this time it worked. If it's very low, so they say it's 25%, it's probably not the best research and the match, but still it would have some protection.
I know we were talking a little bit before we started the interview officially about the shingles vaccine, and we just wanted to touch on it because I have personally had a couple of people ask me about it or talk about how they've had reactions to it. And as you said, it's a relatively new vaccine this year for shingles.
Not this year. It's been, I think, about 2 or 3 years. It's called the Shingrix. That's the only brand we have. We used to have a live vaccine called Zostavax, and that was not as effective. It was maybe about 5 years that would be protective. But the new one is protective. They say lifelong. You get 2 doses, one and then 6 months later. So there's 2 doses, which is supposed to protect you for your whole life. So that's the new one that's now recommended.
Are you concerned this year about the percentages of people who will or will not get the flu shot?
I'm hoping that more or all of us would get. There is a false sense of security, I feel, which people think because we are distancing, we are wearing the mask, we don't go out, we are protected from the flu, which might be, I mean, might have some truth in it. But my thing is, if, I mean, you, like, even though you do all those, everything, you still, there's a chance of you touching or getting the flu from, because you're not always going to be isolated. So if there's anything that you can do to prevent the flu shot, the flu shot is one of the best things you can do. So I would recommend for all to get it.
It is true, isn't it, that the symptoms of COVID and the flu are quite similar, with the exception of maybe loss of smell and taste?
That's true. So it's very hard to differentiate COVID and the flu, because in March, I think, when the COVID season started, I remember patients calling with fevers, muscle aches, runny nose, and at that time we were not quite certain that COVID was still new, and I thought it was all the flu because the symptoms were very similar, and later we learned, oh, it could be COVID. Yeah, but COVID does have this specific symptom of loss of smell and loss of taste, which we haven't seen in the flu. But not all patients with COVID have it, so it's not like, oh, you don't have loss of smell and loss of taste, so it's not COVID. It's hard to say.
I had a physician once tell me that the one thing, if he had to pick one thing he would do every year to stay as healthy as possible, it would be to get the flu shot.
That's true. Yeah, and and one of the other things I want to stress is it's not just for you. Say you're young and healthy, you won't die or get sick from the flu, but you can infect the others around you. Let's say a pregnant woman or someone with heart disease, diabetes, or another older person, and they can get sick and they can die. So it's not just about you protecting you; it also protects the community and others around you. So yes, I would say, please, all of us should encourage each other to get the flu shot.
Yeah, and we have a graphic up right now as you were talking about how long you're actually contagious, which is for quite a while.
That's right. I didn't quite get the question.
Yeah, so it looks like you're contagious for quite a while, even before symptoms have started with the flu, that is.
That's right. It could be about like maybe a day or two before you get the symptoms, and a week into it, you can be contagious. So so I've seen that COVID can be asymptomatic, less so with the flu. I think most of us do get symptoms at one point, but you can be contagious a day or so before.
All right. Dr. Kumar, thank you so much for being with us today and giving us the latest on the flu vaccine. I'm particularly impressed about how GBMC is really trying to work around people's fears of COVID and providing flu shots. So thank you so much, and I'm sure we can find out more information. And I know you're going to be switching out because we have another guest joining us to talk about the pneumonia vaccine. Stay healthy, and thank you for all you're doing.